At the Leiden University Medical Center, our headache group is since the early 90s very much involved in genetic studies. So we are involved in large, what's so-called GWAS studies, where we are looking for genetic factors involved in migraine. But genetics will not be the only explanation for the occurrence of migraine and chronification of migraine. And so that's why we started also what's called an epigenetic study, where you look at methylation of the DNA and the changes of the methylation of DNA. And we started by doing that in a large group of almost 100 patients with chronic migraine, with also medication overuse. And we started treatment for them. And the most important treatment for these patients was withdrawal of the medication overuse. And we divided the group in those who were responders and returned to the episodic state, and those who remained chronic migraine. And then we looked at the epigenetic factors, so the methylation of the DNA, and whether there were changes in the DNA methylation. And actually we found several factors to be involved in this change. Some of them are important and implicated in synapse and in transmission, neurotransmission. And one very interesting one was also involved, to make it even more complicated, in the methylation itself. So we looked at methylation changes, and we found a factor that actually also involved in the methylation of the DNA itself. And these data were presented by Irene de Boer. She's one of the PhDs of our hospital. And we're doing this in close collaboration with Australia, with the group of Dale Nieuwholt. And I think these are the first steps in unraveling the epigenetic status in migraine patients.